Hello, everyone. I'm Jean Birchman. I'm the Executive Director here at the Spina Bifida Association of Greater New England, and I'm here with Laura Lambert, who is our Operations Manager. And we are very pleased to welcome this morning Dr. Mary Dubon from Boston Children's Hospital. Dr. Dubon is part of our October Spina Bifida Awareness Month speaker series, and we're very grateful to have her here this morning. She's going to be speaking to us about youth athletes with disabilities with a special focus on youth with spina bifida. So I'd like to introduce Dr. Dubon and read you a little bit about her background, and then I will turn it over to her. So Dr. Dubon is a pediatric rehabilitation medicine and pediatric sports medicine physician at Harvard Medical School, Boston Children's Hospital, Spaulding Rehab Hospital, and is an assistant fellowship director of the Pediatric Rehabilitation Medicine Fellowship Program at Spaulding Rehab Hospital and Harvard Medical School. Dr. Dubon completed a doctorate in medicine with distinction in service through Albany Medical College with a thesis entitled Promoting the Health and Wellness of Individuals with Disabilities Through a Health Fair Focused on Healthy Living and Obesity Prevention, a project connecting individuals with disabilities and their caregivers to physical activity and nutrition programs. She completed internships at St. Vincent Hospital and Healthcare Center, Physical Medicine and Rehab residency at the Rehabilitation Institute of Chicago, which is now Shirley Ryan Ability Lab, the McGaw Medical Center of Northwestern University, a Pediatric Rehabilitation Medicine Fellowship at the University of Washington, Seattle Children's Hospital, and Pediatric Sports Medicine Fellowship at Ann and Robert H. Lurie Children's Hospital of Chicago, McGaw Medical Center of Northwestern University. She's board certified in PM&R, Pediatric Rehabilitation Medicine, Sports Medicine, and Brain Injury Medicine. She's clinical director of Special Olympics Massachusetts MedFest and is a member of the Special Olympics Pediatric Screening Force. She's the chair of the American Pediatric, she's the chair of the American she is the director, the chair of the American Academic of Physical Medicine and Rehabilitation Pediatric Sports Medicine member community and vice chair of education of the AAPM&R Pediatric Rehabilitation Medicine member community. She's provided sideline coverage for numerous sports medicine events. Dr. Dubon has over 20 years of experience with working with and advocating for the needs of individuals with disabilities, including as a camp counselor, Best Buddies member, leader, and Special Olympics volunteer. To our knowledge, Dr. Dubon is one of only 2 individuals in the United States board certified both in pediatric rehabilitation medicine and sports medicine, providing her an excellent foundation for her academic focus on sports medicine for individuals with child onset disability. She's co-principal investigator on Harvard Medical Education Harvard Medical School Medical Education Project, focused on implementing disability education into the Massachusetts General Hospital medical students' curriculum, supported through grant funding from the National Curriculum Initiative in Developmental Medicine. She's co-investigator on the project entitled Virtual Peer Health Coaching as an Effective Intervention for Increasing Physical Activity in Adolescents with Physical Disability. She's supported through grant funding from the Deborah Monroe Noonan Memorial Research Fund. She co-organized the 2019 Boston Children's Hospital McKaylee Lecture Series Sports Medicine Conference on the topic of youth athletes with disabilities. She's authored several articles and book chapters on sports medicine and musculoskeletal care of individuals with disabilities. And her academic goals are to continue research and academic writing on musculoskeletal and sports medicine care of individuals with child onset disabilities with a focus on injury patterns and injury prevention. All of which to say, we are in very, very good hands this morning with Dr. Dubon. So with no further ado, I would like to thank her and welcome her and turn it over to her to present to us this morning. So thank you.
Thank you so much for that introduction. So it's such a pleasure to be here. I'm really excited to be speaking to you today. And yeah, so I've been in the Massachusetts and Boston area for a couple of years now, and really excited that I'm able to speak with all of you because I am also part of the Spina Bifida clinic over at Boston Children's Hospital. And so I've been really able to talk a lot about my passion and help connect people to sports, which has been one of my big passions. And we can kind of go through some of the things that I'm referring to with that today. So again, I'll be talking today about youth athletes with disabilities with a special focus on youths with spina bifida. So I do have some disclosures just in terms of funding, and they were mentioned a little bit during the intro, but I do have some affiliation with Special Olympics and with National Curriculum Initiative in Developmental Medicine and with the Deborah Monroe Memorial Fund, which should not affect my presentation, but I do like to be honest about disclosures about funding. I like to always start out with acknowledgements as well. And in addition to obviously thanking so much the Spina Bifida Association of Greater New England, just some acknowledgements regarding this presentation in particular, because I don't think I'd be able to pull it off and put it together the way that I have without the help of some of the individuals here. I'll kind of go through today. There's a series of 2 review articles that I worked with colleagues on putting together a couple of years ago. And a lot of the information here was gathered when we were doing those review articles. And it's a passion project for me because it's right up my area of interest. Dr. Amy Houtrow, who's actually well-versed in taking care of individuals with spina bifida, had actually invited me to write those articles, and I'm so very grateful to her for that. And then the others listed on this list either have kind of helped me along the way in terms of writing the papers, or have been mentors or great support along the way, or partners in working with youth athletes with disabilities. So I just wanted to point out the 2 papers that I'm referring to. So the first paper is Youth Para and Adaptive Sports Medicine, and the second paper is Clinical Considerations and Resources for Youth Athletes with Intellectual Disability, which really focuses on Special Olympics International. So when we talk about sports and sports for youth with disability, we can mean a lot of different things. And so that's why I like to be kind of pretty specific about what I'm talking about, because I have an interest in taking care of all athletes, including athletes with physical disabilities, intellectual disabilities, etc. But there is a big distinction in terms of what we're talking about with different sports, and it's important for us to be deliberate in that so that we know who we're talking about, we know that we're connecting people to the right things, and that we know that we're all on the same page when we're discussing certain topics. So you've probably heard some of these terms, parasport or adaptive sport. And this is a definition that I really like. Now, it's not universal that everyone uses the same definition for parasports or for adaptive sports. And so it's not going to be 100%, but this is the definition, and this is the reference where I got that definition that I tend to use. So when we talk about parasports, we're talking about sports in parallel. So in parallel to the general population, meaning sports for individuals that might have physical disabilities or visual differences, so blindness or low vision. And in some cases, folks who might have some intellectual disability, but the sports are specifically geared towards that community. When we say adaptive sports or adapted sports, so people will use either one of those terms, typically what we're referring to is sports that are specifically adapted from a version of the general population. So for instance, there's basketball in the general population, and then in adaptive sports, there's wheelchair basketball. But the thing is, not all parasports are adapted from the general population. There are some parasports that only exist in the parasports world. And so that's why I do like to make that distinction between the 2. That being said, not a huge deal. A lot of people refer to adaptive sports or adapted sports and use the terms para and adaptive sports interchangeably. But I always kind of like to start with that definition that I tend to use. Now, what I want to kind of show you guys is a video of what I mean by parasport. So I'm just going to stop the share for just a second here, and then I'm going to reshare a link here where we're going to watch one of my favorite videos to watch. And what I like about this video is that it goes through and shows lots of different sports that are in the Paralympics.
Yes, I can, suddenly, yes, I can. Gee, I'm afraid to go on.
So there's track and field events
yes, I can.
within the Paralympics.
Take a look, what do you see? 133 pounds of confidence. Got the feeling I can do anything. Yes, I can. Something that sings in my body's telling me. Yes, I can. I was just born today. I can go all the way, yeah.
It's wheelchair rugby.
I can.
Not everything that he does is necessarily a sport, but he is pretty impressive with his extreme activities that you'll see him do throughout the video. So that was wheelchair basketball, which is one of the most common adaptive sports that people know about. And then you saw wheelchair fencing there as well.
Yes,
and you can hear there for blind athletes that they use the sound of the ball to help them with that sport.
I can. Yes, I can. Yes, I can. Yes, I can. Yes, I can. Hey, yes, I can.
No, you can't.
Yes, I can! Are you ready? I can climb Everest. Yes, I can. I can fight here on Mount Everest. Yes, I can. I was just born today. I can go all the way, yeah! Oh.
Not an official sport. So what you just saw there was an advertisement, a video for the Summer Games, the Paralympic Summer Games a few years ago. And so that, that really kind of demonstrated for us what the different summer sports are. So I find that video helpful on several accounts. Usually when I'm telling people about what para and adaptive sports are, that's a good video to kind of go through it. And I also find it a video that really aligns with how I feel about things too, which is, you know, for individuals with disabilities, there may be barriers that may make things more challenging in terms of accessing physical activity in sports, but I very much find myself to be an advocate to try to help connect people. And when there's a will, there's a way. And so there's always something that we can connect somebody to. And most importantly, something that should be fun for the individual as well. So that was Paralympics. Now Paralympics is the elite level of para and adaptive sports. So obviously not everybody is going to compete in the Olympics, and obviously not everyone's going to compete in the Paralympics, but it really does demonstrate when we're talking about para and adaptive sports on a local level, those are the types of sports that people are playing, because there's oftentimes clubs that have Paralympic style sports. So that's usually what I mean when I'm talking about para or adaptive sports. And so the Special Olympics is separate from the Paralympics, but I found even at national conferences where people shouldn't necessarily be getting them confused, that there is a lot of confusion that people have between the two. So I always like to make that distinction. Both are phenomenal sporting organizations, but they're different. So again, the Paralympics is Olympic level of sport. And if you've seen any of the Paralympic Games, which it's great because they're starting to get more televised than they used to, you know that they usually happen around the same time as the Olympics, the same years that the Olympics are happening. And it's all part of the same thing. Olympics and Paralympics really are together as one. But the Paralympics focus on para and adaptive sport. Special Olympics is an organization specifically geared for individuals with intellectual developmental disabilities. Now, when I talked a little bit about para and adaptive sport, I mentioned it's usually when we're talking about, we're mostly talking about physical disabilities or you know, visual differences such as blindness or low vision, but there are some activities within para and adaptive sport that there are qualifications for intellectual disability. Now, Special Olympics, the whole organization is for individuals with intellectual disability. Now, you can have a physical disability too, but the intellectual disability is one of the criteria for participating in Special Olympics. And the thing that I think not everyone necessarily knows about Special Olympics too is that it really has such a wide range in terms of novice, so beginner, new to the sport, learning it, doing it for fun, all the way through really elite athletes who go to the USA Games, who go to the World Games. And so this video that I'm going to share here with you guys is from the USA Games a few years ago. And so I think that this kind of shows a lot of the sport options within Special Olympics. So I'm just going to share screen here. And this one is also the summer games. So again, showing a lot of summer sports today, but there certainly are lots of winter sports as well.
I am not a stranger to the dark. Hide away, they say, 'cause we don't want your broken parts. I've learned to be ashamed of all my scars. Run away, they say, no one will love you as you are.
I'm asking you, athletes, to show the world what it looks like to lead from the heart. Franny, do you have a message for all the athletes?
I love you. Look out, 'cause here I come. And I'm marching on to the beat of drum. I just want to make my family proud.
I feel so happy to be able to compete with a group of guys that I love.
So you can see there's so many different sports, really quite a wide variety.
I just proved them all wrong.
All the athletes that were here qualified to be a part of the USA Games.
Thank you, you as well.
And there are different levels that people qualify within.
No matter what your disability is, you can compete, and if you train as hard as you have, you can win gold just like I did.
I am brave, I am bruised, I am who I'm meant to be. This is me.
So now you guys have officially watched two of my favorite videos, but really I think that my goal there was to show you guys the distinction and the differences and also all the opportunities that are available as well. So I'm going to go ahead and go back to the slides. We could talk a little bit more. All right, so now I think that, so obviously I just showed you two different classifications or types of categories of sports for individuals with different disabilities. But just because you have a disability doesn't mean that you have to play in a league or a club or a sport that's specifically meant for an individual with disability. There are tons of people that play on general sports teams, and I'm sure that there's people listening in today who know somebody who has spina bifida, who plays in a general sports team. And sometimes there need to be accommodations for the individual, and sometimes the local teams are willing to do that, or able to do that. And so I think it's just, you know, when I think about categories, there are different categories of different types of organizations to look at, but don't necessarily neglect that general sports teams may work out as well too. And I know tons of people who've actually done both too. They've been on general sports teams, and they've also been on, you know, say an adaptive sport team as well. So when we actually look in the literature, and this is certainly something that we see in clinic as well, but we know that sports participation among youth with physical disabilities is actually decreased compared to the age-matched peers. And so we know that we have work to be done to try to help get people involved. There's also decreased diversity of sports participation. And again, I feel like a lot of this is just because of access and what society has to offer. And so there's a lot of people who may live in areas that in the state, there's only one group that does adaptive sports, and maybe they have 4 sports. And so then you have 4 sports to choose from, and it might not be the activity that you prefer. So for instance, for me, when I was growing up, I tried out a couple of different things, and there were some sports that just didn't work for me. In fact, most of them didn't. So dance is my background. And so I always say if wheelchair basketball was the only option to me, I don't know if I would consider myself or feel like I'd be an athlete, because it's not something that I enjoy. Basketball, at least, was not something that I enjoy. But that's where I think there's so much more work for us to do in terms of getting more opportunities available. And I think one of the great things about New England is I've been really happy with how many opportunities there are available with lots of different diversity. And then just looking more specifically with spina bifida, I found a couple articles that kind of spoke to this. And what they did find was essentially that there was not as much sports participation as we would have liked necessarily in youth with spina bifida, and that as kids get older, it became less, which I think is something that we see in general, but certainly something that we see in individuals with disability. And so again, just something that for all of us to continue to advocate for, to make sure that there's avenues for transportation, and there's avenues for access and programs available so that people can continue to participate in physical activity and sport and things that are healthy and fun for them throughout their lifespan. And so this article also kind of had the same message as well, is that, you know, adults with spina bifida, we're not really participating in physical activity as much as we would have liked. And so again, this just speaks to more work to be done to make that more accessible, because certainly, again, if you only have one opportunity in the state that's specifically an adaptive sport and it's 4 hours away from you, I could totally understand that would be a limitation for anybody, right? And so this is just, I think, more information to kind of help us understand the importance of us continuing to advocate for accessibility. So, you know, with this, I always talk about what the actual guidelines for youth are. So these are like straight from the physical activity guidelines for Americans, the newer edition. And really what it comes down to is, on average, for school-age children and adolescents, so ages 6 through 17, should do about an hour of physical activity daily. Now, that can be inclusive of, you know, if you use your wheelchair to propel yourself to and from school, and that's, you know, I don't know, a half a mile a day or something like that, then like that counts towards it. So it doesn't all have to be, you know, super intense or a sport necessarily, but we do want people to be doing physical activity about an hour daily. So that's hard. I think that that's something that we, across the entire population of children and adolescents, we don't have full compliance with, and it's certainly something that we've seen, as I mentioned, less of among individuals with physical disability. And I think a big part of that is because of access, right? I think a big part of it too, maybe, and I'd be interested to hear people's thoughts, But I do wonder too how often it gets brought up by doctors and clinics, and how many people are really counseled on how much activity they should be doing. Because this is one of my favorite things to do with the slides is it's the same activity guidelines for youth with disabilities. So, and I think that that's something that I really focus on is to make sure that, you know, physical disability definitely makes things sometimes harder in terms of access, but that's our job as advocates to try to figure out a way to make it more accessible and more feasible for people to be able to meet those guidelines, again, for your physical health, for your mental health, for so many things that it really helps out with. And then these are the guidelines for adults. So once you get to adulthood, it's not quite as much, that's the recommendation, but it's about 150 minutes, so 2 hours and 30 minutes spread across the full week. And so there's a little other variants of it. If you do more intense activity, it might be a little bit less. But either way, the point is it really is the same guidelines for youth and adults with and without disabilities, with a little caveat of obviously within limitations. So for some people, it may be not feasible or not possible to do the 60 minutes, or maybe not, or the 150 minutes, or maybe not, like there may be some medical contraindications to doing that, and that's okay. But if you're physically able to, that is what the recommendation is. So I kind of alluded to the fact that there may be some precautions that limit some things with physical activity. And so precautions basically are things like, you know, a simple one that people might know about is if you break your leg and or you break your arm and somebody says you need to be in a cast and you need to not put any weight on that arm or that leg. So that's what we mean by a precaution. Now, for some individuals with physical disability, there may be precautions that are for, you know, not just when you break a leg or break an arm, but things that throughout that we need to think about or consider. So for some folks, if they have, you know, for instance, cardiac disease, there may be some limitations on how hard the heart rate goes, or there may be some limitations on what type of physical activity a cardiologist would want. So those are some examples there. Now, you know, it's not something that I can give you 100%. This is the rules and these are the precautions for everyone who has spina bifida. These are really things you need to talk to your doctor about to learn what the precautions would be for you, because everyone's different. Everyone has individualized precautions. Now, some examples may include, you know, it's pretty common for youth with spina bifida to have decreased skin sensation. So just kind of being aware of it. It doesn't say like, oh yeah, you can't participate in sport because you have decreased skin sensation, but those are some of the things that we need to be careful about, right? So if you're doing sled hockey, which is a really cool sport where you're playing hockey in a sled that's fit to you, fit is really going to be important for everybody, but it's going to be super important if you have difficulty feeling your skin, because we don't want you to develop a pressure sore or an ulcer or blisters, and then you wouldn't necessarily know or feel it. And it may be noticed kind of later on, could be infected or could have gotten more severe. So those are the reasons why we think about things like precautions. Okay, what are things that, because of your spina bifida or because of other medical conditions that you might have, that we need to make sure we're being you know, considerate of and we're being careful with when we're doing sport to try to prevent any kind of injuries or medical conditions from it. So this I like to point out because I think I mentioned earlier about the fact that I'm always curious to hear if people are really told about physical activity and if that's something that gets brought up, because I think there's, you know, whenever you have a medical condition, there's so much that doctors talk to you about in terms of the medical condition. And I always worry that exercise gets left off a little bit, and I hope that I'm wrong. And obviously, if we were not in a virtual world, I would love to be polling the audience a little bit about this so that I can learn a little bit more about what people's experiences have been. But I like to point out, so this is actually from 2008, and I know they're working on another version now, but there's actually a policy statement that says all pediatric, like all pediatricians, all pediatric specialists, it is our job to make sure that we are talking about these things, that we are bringing up what those physical activity recommendations are. We are trying to connect people to sports and recreation and physical activities because it's part of health, it's part of the overall picture. And so that's something that I really think rings true for me and something that I always try to make sure to talk about. So things that make people more likely to participate in physical activity, there have been some studies that have looked at this, and it would be, knowledge of health benefits. So if you know, okay, this is good for me, motivation to be healthy and active. So you really want to be healthy, belief that physical activity is fun. So again, like I mentioned with wheelchair basketball, for some folks, that is their sport, and it is really cool. I've helped out with medical coverage and with volunteering with it before. It's a really hard sport and it's really amazing, but for me, it wouldn't be the thing that would be for me. So you have to find something that's fun for you. And then access to adaptive physical activity resources. So again, if you live in a state where there aren't any adaptive physical activity or sports programs, that is going to be harder. And we'll talk a little bit later, but actually during the pandemic, there's been some online resources that have come out, and I feel like this has actually made access a little bit easier, and I'll share those resources with you guys because I do think that is super helpful, because I know transportation can be an issue. And then obviously during the pandemic, most folks are trying to limit how much they're doing outside the house, and programs are a little more limited in terms of what sports they're doing in person as well. And so then what are the barriers to physical activity participation? So what are the things that make it harder to actually make that step to participate in physical activity or sports? So if you're not motivated, if you're like, I'm just not interested, you don't have time, if you don't have access to transportation, which I know is a big issue, especially for wheelchair users. If there's financial stress, so if it costs money to do that and it's just not something that you have the means to do at this point, it's totally a barrier. Or poor accessibility or access to adaptive resources. So again, like I mentioned, if you don't have many programs that are right around you, then that would make it harder too. So these are all really reasonable barriers and real things that all of us who kind of help advocate for better resources and better participation really need to be aware of as we try to approach this topic and try to figure out how we can get people to have healthy lifestyles and to participate in sports and physical activity that's fun for them. So when we actually are talking about para sports, I just wanted to kind of give an example of the summer sports and the winter sports that are currently there for the Paralympic Games. Now again, Paralympic Games elite level, but more of your local groups are going to essentially be clubs that a lot of them are doing the same sports that are in that elite level of Paralympic Games. You might see other things though too, which aren't necessarily Paralympic sports, but are adaptive activities such as adaptive biking and sailing and other things as well. But these are the official Paralympic summer sports. And these are the official Paralympic winter sports. So a smaller list for sure, but a lot of really intense sports that are present as well. And then para ice hockey is also called sled hockey. It's also called sledge hockey. So you may have heard of that one. And that was the one I mentioned earlier also. So when we actually are looking at athletes who are participating in like a competitive para sport activity, there's usually what's called a minimum impairment criteria, which is an official list of which impairments qualify for the sport. And it is really unique to each sport. So for instance, for wheelchair basketball, so if you were to participate in the Paralympics wheelchair basketball or high level of wheelchair basketball, there's kind of a list of, well, these are the disabilities, these are the impairments that qualify for participating. And the reason why they do it that way is because they really want to kind of level the playing field. So make sure that, you know, it's the strongest athlete, not the person with the less disability that's going to get the advantage, right? So they really have a clear criteria for this. And like I said, classification really varies sport to sport, and it's leveling the playing field. The reason for it is not to try to exclude anyone, but really it's to try to make sure that, you know, team A versus team B are fairly similar, so that really, you know, in terms of disabilities, so that when they're playing, it's really the sport, the game, the athletics that you're comparing in terms of the competition. And so when people do classification, so there's actually this whole process that goes underway where people are trained. They go to hours of training where they learn to be what's called a classifier. And so a classifier is either usually a physician or a physical therapist with a special interest in para and adaptive sport. And they do an exam. So they actually, it's kind of like a doctor's visit where they take some history. They say, okay, what kind of condition do you have, and what do you take any medications, and how does your spina bifida affect you, things like that, so that they kind of have an understanding of your diagnosis. And then they do a physical examination so they can see your strength really, like really particularly in different muscle groups and range of motion, how much your body is flexible in different areas. And then there's a functional examination too. And so I'm not a classifier. I have shadowed classifiers though at the Veterans Games, so the National Wheelchair Veterans Games. And so at those games, when I shadowed the classifiers, for instance, the functional examination, now, there were some sports there that were sports that are not in the Paralympic Games. So for instance, bowling was one of them. And so when we would have somebody come in and they were trying to get classified for bowling, there was actually a bowling ball there and they would demonstrate how they would bowl. And so for that was also part of the exam to kind of look at, okay, how does the spina bifida, or you know, whatever the condition is, how does that affect the way this person plays their sport? And so then with all that information, they go ahead and give the individual a classification score so that they know that they're going to be competing against athletes that are in their same classification level. Or for team sports, there's kind of an interesting way that it's done where it's a certain number in terms of classification on either side of the court. So this is the example of you know, wheelchair basketball classification. So it goes from 1 to the 4.5, and with 1, it's individuals who may have less movement at their trunk. And so because of that, they need a higher backrest of their wheelchair. Whereas if somebody's at a 4.5, they have full motion at their trunk. So they're able to kind of reach and pass the ball a little bit further out. And so it might be somebody that, for instance, has an amputation of their leg, and so their trunk control is not affected. And so what happens is there's 5 players on each team, and there's no more than 14 total points on a court at a time. And so for the team, so how that, you know, makes it like even on both sides is then you don't have all folks that have the ability to move their trunk around more. That'll put them at a different advantage than the other team, right? And so you want to be able to match the classification on both sides, so that again, when you're watching the sport, when you're playing the sport, when you're, you know, judging or refereeing the sport, you're doing it based on the athleticism. You're not doing it based on the disability. So in order to participate in sports, for most children and adolescents, and then also if you're doing more elite sports, you usually want to get an exam done before it. And for a lot of sports, it's actually mandatory. And it's interesting because I think for a lot of the local and, you know, local groups here and throughout the country, local groups that occur, there isn't necessarily a requirement for a pre-participation exam, although I do recommend it and think that it's only going to be something that's going to help you learn a little bit more about your body. And then it's a good health check-in. That's a lot of times a prompt for folks to be like, oh yeah, it's a good time to go to the doctor because it's my yearly time for a check-in for this. And so some examples of what things that people might ask about are, you know, okay, do you use a walker? Do you use a wheelchair? Do you have a history of bone fractures? Do you need to use catheters for your bladder? All things that probably your primary doctor knows a whole lot about. do you know what you were classified at in the past for your para sport? And then that actually helps classifiers too, because then they kind of have a sense of, okay, this is where you were before, and see if that's still where you are, because it does get reevaluated. Dietary considerations, if you have any hematologic, so like bleeding disorder type conditions, latex allergy, which I know is a big one for youth with spina bifida, because some equipment might have latex, and so I think it's important for people to know about that. And then if you have a seizure history, if you have a shunt, so these are, and if you have trouble feeling in your skin in certain areas, because that may increase your risk of pressure sores like we talked about. So again, the reason for this is not to say, okay, well, you have this so you're excluded from sport. Not at all. The reason for this is like, okay, let's do a screen. So the big reason across the whole country that pre-participation physicals are done before people participate in sport is because there's a small percentage of the population that has cardiac conditions that could be really dangerous for sport, right? And so everyone should kind of get screened for that with the pediatrician or your family doctor, your internal medicine doctor, listening to your heart, and they might do specific maneuvers that they'll have you in this position, that position to listen to your heart. And they'll ask you some questions too to make sure that it's safe. So that's a big reason that we do physical exams. Then the other reason too is like, okay, well, what are these other little things that we learn that might give us good information about how we make sure sport is as safe as possible for you? So again, having trouble with feeling your skin in certain areas means, okay, we need to really make sure that this sled for sled hockey fits, and if you grow, that we're growing it with you, or we're getting a different one and we're really keeping a close eye, right? And so here I will just go ahead and share that link that I had pulled up as well. So this is the form that you can bring with you to the doctor's office or share with your doctor. And I could share this information with you guys. So it's what's called the Pre-Participation Physical Exam, or PPE. And on this website, there's a couple of forms. So there's the history form, there's the medical eligibility form, and then there actually also is a form that's, in addition to those other forms, these other things to ask about for the doctor to kind of make sure that they go through with you, like we talked about, fracture history, and if you use a wheelchair or walker, if you have trouble feeling your skin, those types of things. So that's called the Athletes with a Disability form. Now, what I'd like to also point out is on this website, they separately have the forms for Special Olympics. And I'm actually proud to say that because of a conversation that I had with some folks at the American Academy of Pediatrics, this did go onto the website, because what we were finding was, and I had heard this from one of the head directors of Special Olympics Medical, was that a lot of athletes were bringing in the American Academy of Pediatric forms to Special Olympics to say, hey, these are my forms to say I qualify. And unfortunately, the Special Olympics forms are different. And so then they would have to go back to their doctor or have their doctor fill out a different form, because there are a bit more details on the Special Olympics medical form that really are geared towards athletes with intellectual developmental disabilities. So if that is one of the activities that you want to participate in, make sure that you're using the right form for it, and you can point that out to your doctor too. Okay, so coming back to our slides here, just a moment. Next I wanted to just talk a little bit about when your doctor kind of goes through and talks to you about things, that they may have specific questions for you because you're spina bifida, right? And so the article that I wrote with some colleagues goes through lots of different medical conditions causing disability and what types of things the doctor should be thinking about. And so again, we've talked about a lot of these, and these are things that I'm sure you guys are very familiar with, because you may have a Chiari or a neurogenic bowel or bladder. And so these are some of the things that you're going to want to talk to your doctor about, because again, it's not going to prevent you necessarily from participating in sport. There may be something that your doctor finds that's like, okay, your heart or something that they want to get reevaluated. But the real purpose of talking about these things is so that you make sure that when you're participating in sport, that we're paying attention to those things and being like, okay, you know, if you're going to be in a tournament, don't forget to cath, so that, you know, and make sure that your coach knows that you have to cath at such and such time. And those are the types of things that, especially for the younger kids, might be really helpful and really good reminders. So this is all just kind of to help make sure sport is as smooth as possible and as healthy as possible. For really elite athletes, you know, if you wind up participating in the Paralympics someday, it's important to know that some medications that you might take might actually be on a list of not allowed medications according to the organization. But that doesn't mean that you can't take your medicine anymore. And I would never recommend that anyone stop taking a medication just because they want to participate in sport. Not at all what I want for anybody. But what you do is you talk to your doctor and you say, okay, I need to take this medication for my health, but it's on the list. And so what your doctor writes is something called a therapeutic use exception. And so it says, this patient is on this medication. This patient is on Ritalin because they have ADHD, and it's not that they're using it to try to get an unfair advantage on sport. And so that's what we mean by a therapeutic use exemption. So if you're trying to go to an elite competitive sport and you're on medications, it's important to talk to your doctor to make sure that they look up that list and that they make sure if you have any medications that are on that list, that then they say, okay, well, this is an important medication for you to take. So I want to write that letter. Or they may say, actually, I don't know that you need this medication anymore. Let's try to wean it. And that's a conversation that you have to have with your doctor and not one that you should make on your own. So make sure that if you are thinking about these types of things, that you talk to your doctor first about it. So in terms of injury patterns, when we're talking about para and adaptive sports, so again, Paralympic style sports, most of the data and the information that we have is actually from research done from the Paralympics. So there's been some more recent studies that have been on that. There unfortunately haven't been a whole lot of studies on youth. And so that is an area that I hope to kind of study over the course of my career. But what we can best do now is just take the information from the more elite adult athletes and see how that applies to our population. So not surprisingly, athletes who use wheelchair users have more injuries to their arms, and then athletes who walk or ambulate have more injuries to their legs. But the rates in terms of how much, like what percentage of people actually have injuries are fairly similar to sports in the general population. So strains and sprains and skin injuries are actually some of the most common things. So again, when I was talking about like sled hockey and making sure that the fit is right, that stuff's really important because skin blisters and wounds are some really serious things that really actually can make you miss a lot of sport time. So they're really important things for us to try to prevent. And so then in terms of the winter sports versus the summer sports, those winter sports are super fast down the slope oftentimes or on the ice. And so there's a lot more acute injuries. So like collisions, head injuries, fractures, or bruising. And with summer sports, there's a lot of the skin injuries because of sunburn or pressure or blisters from friction. And then with wheelchair track in particular, there were some nerves like carpal tunnel type nerve injuries, some median nerve mononucleopathy is what that's called. And then at the ulnar nerve mononucleopathy as well. So that's at the elbow. There's kind of a nerve there that sometimes can get a little irritated as well. So other things that we think about are overheating or getting too cold because some folks may have difficulty with controlling their temperature. And so that's an important thing for us to pay attention to. And so when we think about how do we try to prevent injuries, particularly like wheelchair users, how do we try to prevent those arm injuries that we're talking about? The way that you propel your wheelchair is actually pretty important. And so if you've never actually, for instance, gone to PT to see if you're propelling your wheelchair in a good way, or if you have shoulder pain or wrist pain, you know, it might be a good thing to check in with a rehab doctor or a sports doctor to kind of look at the way that you're propelling your wheelchair, and also they may make adjustments to the wheelchair itself or may make recommendations to say, let's go to PT and like work on that pattern. Now, scapular exercises, so exercises to make you stronger so that it's easier for you to propel your wheelchair the right way, I tend to think that there's probably some benefit to that, but there hasn't been a lot of good research that has really said much one way or another about it quite yet. So I think there's more work to be done there. So what we do know is the Americans with Disability Act really is about trying to prevent discrimination against individuals with disability. And so if there's a public area that's supposed to be for, you know, participation in recreation or sport, it should be accessible. So those are things that we all need to kind of continue to advocate for. We know that American Academy of Pediatrics is behind us and wants to help everyone promote the importance of physical activity and sports participation. And Paralympics is starting to get more media exposure. So we're hoping that over time, people are going to be learning more about this, understanding the importance of it, and hopefully that'll open doors for better access. But we know there's more advocacy to be done. So these are some of the resources I wanted to mention. And again, I can have this sent out so Jean can share this information with everybody. But since COVID, there's been some resources online for online adaptive sport or online adaptive physical activity, which is making it a lot easier for people to be able to meet the physical activity requirements from home. So I'm happy to share those resources with you guys. So then I just wanted to move, obviously we talked a lot about physical disability here, but certainly there's a lot of youth with spina bifida who also have intellectual disability. And so not only would the individuals be able to qualify for para or adaptive sports locally, but they may also be able to qualify for Special Olympics. And a lot of times it's helpful to kind of look into both organizations to see what's the best fit, or kind of do a little bit with both organizations. So Special Olympics, it's really a year-round training and athletic opportunities that are available, children and adults, and it's really there to try to help with physical fitness, and then also from a happiness perspective too, for courage and joy and really social interaction and skills and friendship. So there's so many benefits that we all have from doing things like physical activity, and certainly Special Olympics really prides itself in making sure that it's a fun, happy environment. And so when we're talking about intellectual disability, these are some of the official the official definitions of it. So essentially it's before the age of 18 that there's a disability that affects both what we call intellectual functioning and adaptive behaviors. And so when we're talking about intellectual functioning, it's usually measured by an IQ test. And, some folks may have had neuropsych testing. And so that's a good way of kind of telling or seeing if there are any impairments related to intellectual functioning. And then adaptive behaviors. So because of the intellectual disability, there may be some help that people might need, or some adaptations that they might need in order to do day-to-day activities such as taking care of themselves and communication and social skills. So Special Olympics is really the world's largest organization that dedicates to children, adolescents, and adults with intellectual disability. And it was started in 1968 by Eunice Kennedy Shriver, because her sister Rosemary Kennedy had an intellectual disability. So I love this oath. It says, "Let me win, but if I cannot win, let me be brave in the attempt." And I feel like that should be a philosophy for all of us in day-to-day life, but that's definitely the philosophy behind Special Olympics. And if you go to any Special Olympics events, sometimes you'll hear everyone kind of say the oath before the competition. And this really kind of shows us a list of all the sports that are out there. So there's tons, and they're always adding, and some of them are not necessarily official sports, but like I know locally, sometimes they have Zumba classes or yoga. And so those are also things that people may want to get involved with. And so there's been lots of benefits that have been cited. So improved sports skills, like pretty much across the board, people felt like their sports skills got a lot better when they participated, and then increased levels of self-esteem and social inclusion. So in addition, the families of athletes felt like they really thought it had a positive effect on time spent as a family. And they felt like, it just seems like it was such a joy to a lot of families that this opportunity was available. And participation positively affected the family, gives them an opportunity to have an activity that the whole family shares, and give them an experience that, to kind of make sure that there's a similar experience between siblings, right? So there may be a sibling with and without an intellectual disability, and sport can be something that really connects people together. So for participation in the traditional sports, individuals have to be at least 8 years old, have an intellectual disability, as we kind of mentioned, and then the athletes are grouped by age, gender, and ability. So again, just to level the playing field. And then everyone's given the chance to participate and perform to the best of their ability. So there's lots of different programs in the United States and so many countries around the world. And this is a pre-pandemic statistic, so I'm not sure that the number of sports competitions each day is quite as high as this states, but you know, pre-pandemic, this is certainly how it was, and hopefully once all of this passes, we'll be getting back to doing more and more sports competitions as well. And then there's also other programs within Special Olympics that I think not a lot of people know about. So one of them is called Young Athletes, and it's for children ages 2 to 7. And this is working on a lot of developmental skills, and so like pre-sport skills as well. There's also unified sports, which I know in Massachusetts, we have several high schools that do unified sports. And so it's teams that have a combination of individuals with and without an intellectual disability on the same team, and, you know, participating in sports like basketball and whatnot through the actual school, which has been a really great experience around the board. And I kind of mentioned the fact that in the Paralympics, there are some categories for folks to classify basically just on the diagnosis of intellectual disability. The issue was that I think there was a little bit of difficulty confirming the diagnosis of intellectual disability. So there had been some controversy in the past about this. So it was more prevalent with the Paralympics, and then that got cut back. And now there are still a couple of sports that you can participate in if your single disability that you're trying to classify under is intellectual disability. So Paralympics and Special Olympics, as we mentioned, hopefully that's something that you guys all got away from the talk, are two very separate things, both fantastic organizations, but kind of serve different communities and different in the way that Special Olympics really runs the gamut and of novice to elite athlete. And Paralympics is really like super elite athletes who are participating in the Olympics and Paralympic Games. So a big thing that we also talk about within Special Olympics community is also inclusive health. So we know things like individuals with intellectual disability don't always necessarily get all the services and all of the healthcare that they need. And that's something, again, that I think that from an advocate standpoint, we just need to continue to advocate for, to make sure that doors are open and that it's a smooth process. And so really there was a big initiative that started in 2016 with the Special Olympics to really make sure that there's a lot of advocacy efforts to try to make sure that doctors have the resources and education that they need in order to take care of people with intellectual disabilities, and that individuals with intellectual disabilities know where to go and what things that they should be looking for too. This was actually one of the big events about this. And so I was fortunate to be at this event where actually the Surgeon General at the time spoke, and I believe he has a family member with an intellectual disability. And so it was a topic really near and dear to his heart. And it really just got together people from all different backgrounds, whether they were in medicine or they were in advocacy, or they were individuals with intellectual disability who were strong advocates too, all in the same room to try to figure out how do we progress things forward to make sure that people have the access that they need to the healthcare and fitness resources that they need. So this is a list here of all the different opportunities within what's called Healthy Athletes, which is a branch of Special Olympics that focuses really on health. So there are these events, and we do have some events within Special Olympics Massachusetts, and the one that we're going to be having soon, we were supposed to have it this year, but because of the pandemic, we had to push it off, but is MedFest, which is those pre-participation physicals. So actually having them done together so that you can go as one-stop shopping to be able to get that screening done by physicians. But right now, what we are recommending, and we do think that this is best practice, and this is a really important thing to do, is go to your primary care doctor for those check-ins, because at this point, having big group of people in one space obviously wouldn't be safe because of the pandemic. But, you know, again, pre-pandemic, and hopefully once we come out of the pandemic mode, there are so many lots of different screening opportunities for folks throughout Special Olympics that might be fitness screenings or feet screenings or vision screenings that are offered by specialists throughout the state and region who are volunteering their time because this is something that they think is important. And so here's a link to it, but these are the forms. And so I had mentioned before that for Special Olympics, it is different forms than for adaptive sports or for general sports. And so this is kind of what they look like. And those are the forms that you'd have your doctor fill out, or if a MedFest event were to occur, that the MedFest team would fill out for you. And so when we think about sports medicine considerations for youth or adult athletes with intellectual disability, we think about the importance of hydration and nutrition, preventing environmental cold or heat stress. Because again, people might be on medications that really affect things like hydration or temperature control, sunscreen. And I think a lot about sports specialization, which essentially means that we know in the general population, I'm sure it's the same, you know, in Special Olympics athletes and para athletes, but we don't have enough data to say for sure, is that it's healthier to participate in a lot of different types of physical activity versus doing the same thing day in and day out. Because if you do the same thing day in and day out, you might put stress on the joints that you're doing the same activity with over and over. And so there aren't many studies right now on what the injuries actually are in Special Olympic athletes. And this is something that I'm actually working with Special Olympics Incorporated on a project that we're just going to be starting out. Actually, the first meeting is going to be later this week. So what we're working on doing is actually putting together a program that would include tracking injuries throughout different Special Olympic events so that we can get a sense of making sure that we're keeping the athletes the day of safe, but then also get an idea of patterns so that we know how to prepare for medical events. And we also, so that we know how to take care of injuries, but also know how to try to prevent injuries, because then we have a better sense of what they are. Right now, it's kind of hard to say what the typical pattern of injuries are, but from at least one study that I looked at, they seem to be similar injuries as we've seen in the general population, which is muscles or bones or joints or ligaments, and then skin injuries pretty common as well. So I wanted to also, I know I put the resources for para and adaptive sport online that have really come out during the COVID-19 pandemic. And then this is information from Special Olympics Massachusetts. They do sometimes have some live online fitness classes as well, or opportunities. So those are definitely things to look out for. And again, I'll share those resources as well. So that's all I have for you guys today. And again, thank you so much for the invitation.
Thank you so much. That was a tremendous amount of information. We're really grateful to you for your expertise and certainly for your time. I did want to just remind people as well that we do have our empowerment grants available through Spina Bifida, and those would be a great way to help ease yourself, at least financially, into one of the many programs that Dr. Dubon just shared with us. So those are available to any member with Spina Bifida, up to $250 a year. So if you want to sign up for a class or try a new sport, or you need some equipment, we absolutely are here to help you with that. So I think that might be a nice supplement to some of the inspiration that you've received through this talk. So many opportunities available to people, and I think we all understand the importance of keeping our bodies moving and what that does for both our physical and mental health, particularly in light of the times that we are living in. So I really want to say thank you so much to you for your time and for your expertise. This was a great way to kick off our speaker series, and we're very grateful to you.
Yeah, thank you guys so much.
I'm going to stop the recording.
Okay.